Hello, I'm Steve Feldman, president of the Human Animal Bond Research Institute. Welcome back for another important session during Pet Week on Capitol Hill. Today, we are so excited to have with us two accomplished veterinarians. Representative Kurt Schrader represents Oregon's 5th District, and he is currently the only veterinarian serving in Congress. And we are also joined by Dr. Mike McFarland, who is the Chief Veterinary Officer from Zoetis. And I'm going to turn it over to these two accomplished veterinarians to have a talk about veterinary issues in Congress and what they see for the future. But first, I want to thank Zoetis for sponsoring this session. Zoetis is one of the founding organizations for HABRI, and we're so excited that they're participating in Pet Week on Capitol Hill. I don't want to talk too long because these two amazing individuals have a lot to say. I'm just going to let them have a conversation about veterinary issues in Congress and anything that they see for the future. So without further ado, I'd like to turn it over to Dr. McFarland.
Thanks, Steve. And I'm excited to be part of another Pet Week on Capitol Hill and to be joined once again by Congressman Kurt Schrader to talk about veterinary issues in Congress and reflect on his long career as a veterinarian and the leader in Congress on animal health and welfare issues. Congressman Schrader is currently serving his 7th term in the United States House of Representatives for Oregon's 5th Congressional District. Before being elected to Congress, Schrader, who's been a farmer and veterinarian for more than 30 years, established and managed the Clackamas County Veterinary Clinic in Oregon City and operated his farm where he grew and sold organic fruit and vegetables. Congressman Schrader currently serves as a member of the House Committee on Energy and Commerce, which oversees a wide portfolio of issues ranging from healthcare to the environment. Prior to joining ENC, the congressman served on the House Committee on Agriculture that successfully passed a 5-year farm bill. He was also part of the House Committee on Small Business and the House Budget Committee. In the 117th Congress, Congressman Schrader serves on the Energy and Commerce Subcommittee on Health, the Subcommittee on Energy, and the Subcommittee on Communications and Technology. As the only veterinarian currently serving in Congress, Congressman Schrader has consistently been a leader in animal health and welfare issues. Much of his life's work has been dedicated to keeping our four-legged friends healthy, and for that, we are incredibly grateful. So Congressman Schrader, it's been great to have you once again during Pet Week, and I wanted to start by reflecting on your impressive career in Congress. When it comes to animal health and welfare issues, I can think of no better champion than you. And on behalf of many of us in the pet care community, we're tremendously grateful for your years of service. So since this is Pet Week, and the focus is on celebrating the importance of pets in our lives, and what are some of the proudest achievements throughout your long career as a veterinarian and in Congress related to pets and animal health?
Well, thank you, Mike. I appreciate the introduction. And it's always, Pet Night is always a big deal here on Capitol Hill. Everyone enjoys it. Opportunity for us all to come together and remind ourselves that the world's a much better place and we're better off having our four-footed friends or sometimes two-footed friends around us on a regular basis. And it's been wonderful being a veterinarian in the United States Congress. I have been more convinced than ever after being here for 14 years that it's very important to have a veterinarian in Congress, especially when it comes to public health. With all due respect to our MD colleagues, I think we're better versed and oftentimes in a lot of the public health arenas following through COVID, felt like I had a pretty good handle on a very difficult situation, and others not as good a perspective. So having veterinarians is important. Found that out very early on. There was another veterinarian in the Congress, Ted Yoho, a good friend of mine from Florida, and he and I partnered together on an errant piece of policy from the Drug Enforcement Agency that would prohibited veterinarians from carrying narcotics in their ambulatory vehicles or their house visit type of vehicles. The goal was, of course, a good one to limit the spread of narcotics, not make them available, but it would have prevented us from doing house calls, would have prevented us from doing farm calls, where obviously analgesics and unfortunately sometimes euthanasia solutions are critical to veterinarians. So it wasn't for Ted and I being here, and we actually passed legislation to make sure that the DEA, with some next administration, could go back on that role, make sure it actually happened. We've been pushing very, very hard on the compounding issue. Again, veterinarians, as we all know, often rely on pharmacies to compound unique dosages and formulations for our tiny friends that the standard medication doesn't work for. So we've been very engaged in that, work closely with AVMA. It's these types of issues where I think the average practitioner doesn't think it's important maybe for someone to get involved as a veterinarian. We just want to do our job, protect our friends that we love and cherish. But if you're not at the table, you're on that table. So we want to make sure veterinarians can talk about some of the critical issues. So frankly, we have a drug user reauthorization program. What does that mean? Every so many years, we re-up and help FDA get through authorizing and reauthorizing a lot of medications we use. And one of the issues that came up a couple of years ago was trying to figure out conditional use boundaries. Some of my colleagues in Congress thought it was a way that the pharmaceutical companies were trying to get around full certification of their medications and formulations. And I assured them nothing could be further from the truth. It is a way that a lot of veterinarians and their owner, the animal owners, can get medications available to them where a big, huge field clinical trial is not feasible for some of these drugs by some of these companies. So we have to use that conditional use permit process. Kind of an arcane thing, but it's really important if we want to make sure some of these medications that are out there in the human field can actually be used in critical situations with our animal friends. And I played a big role in the One Health program. I think some of you are already aware of that. This is a goal where we try and integrate, and certainly the pandemic put a light on this, where we want to make sure that when there's a huge problem like we've had with COVID, that FDA, USDA, EPA, states, and frankly, even our international partners, and health course, HHS, Health and Human Services, all come to the table with one approach. That was part of the big problem during COVID. It seemed like the ball was always moving. You get a little contradictory. So it seemed like contradictory information from one agency or another. And the One Health program, we actually got it approved in an appropriations bill. And we're still working to make sure the general outline comes together in a way that would be really, really helpful. So when the next crisis occurs, and unfortunately it will, we'll be in so much better shape to handle it and hopefully inspire a little more confidence in the American people that there is at least an initial program that everyone's agreeing to and engaged in. In past act as equine veterinarian, we've worked really hard over the years to make sure that horse soring is not only outlawed, but enforced. And we've been working on several iterations. I think we're making progress, a lot of progress in the last Congress. We're making progress this Congress. Tough issue. Some of it revolves around states' rights and that sort of thing. And so we're trying to negotiate that really, really well. Make sure that a veterinarian is doing the actual evaluations. I think that's so critical with hands-on opportunities. We've gotten that, I think, across to our friends in the equine industry. Now it's just a question of hopefully putting final touches together. So a lot could go on. There's a lot of issues out there, Mike, and these are issues that veterinarians are uniquely able to talk about and frankly be authoritative on and have the opinion respected. Not political, just flat out, good science.
Right. And I think I speak on behalf of the entire veterinary profession. And when I say that it's been great knowing that we have you in Congress to kind of look over our shoulders and make sure that some of this attention is being drawn to this legislation that's important for veterinary medicine and animal health in general. Now, one of the more popular events on Capitol Hill is the Cutest Pet Contest, where members of Congress and their staff submit their pets to be crowned the cutest on the Hill. So I have to ask, any interesting insights after meeting some of the pets of your fellow members of Congress and their staff? Pets are bipartisan, right? It's sort of the modern day equivalent of kissing babies on the campaign trail. So has it helped build relationships?
Well, yeah, but to your exact point, Mike, that's why I don't actually pick the winners and losers. They're done by an authoritative panel of so-called experts. So I do not want to get in trouble by not picking your baby, i.e.
Exactly.
But it's wonderful. Usually 3 categories: cats, dogs, and then exotics. And exotics, they run anywhere from turtles to rabbits to monkey. I mean, it's amazing. Farm animal, horses. I wouldn't consider horses exotic, but whatever. But it's a great opportunity, and it's a bonding experience. I think all of us, especially as veterinarians and working in the animal health field just in general, it's important to work with your colleagues. You may have different points of view on a variety of subjects, but you need to feel comfortable that the motivation of that other person is genuine. And what can be more genuine than caring for your pet? Right. And frankly, in my opinion, how the pet cares for you. And we saw that during COVID. They were absolutely indispensable for many people. I think my office, we adopted maybe 3 different pets at least during COVID, as we tried to live out our relative isolation from our fellow human beings. And there was our 4-footed friend right at our side, loving us, wanting us to be there. I think the dogs were probably disappointed when we went back to work. I'm not sure the cats were that disappointed.
Yeah.
But it's a wonderful event. Everyone loves it. And it's really good because it brings the staff together. The staff on Capitol Hill are every bit as important, maybe more important than some of us legislators, in that they help us get through the legislation, make us aware of what's coming down the pike, help us draft responses, work together with different offices. So it helps build that inter-office staff bond in a huge way that allows, frankly, Capitol to function.
Right. So, it feels more important than ever that we find some common ground with each other. And I think we can all agree that healthy pets and nurturing the human-animal bond are good for all of us and our communities. Human-animal bond is so dependent on the health and well-being of our animals, which is where veterinarians and animal health professionals obviously come in. So with that in mind, in your opinion, I think you alluded to this earlier, why are veterinarians so important for animal and public health?
Well, we're at that intersection. Veterinarians, more than our medical colleagues, deal with herd health issues on a regular basis. An outbreak of kennel cough in a dog breeding kennel. It could be a strep outbreak with horses, any number of diseases. So we're pretty well versed in how to deal with that. What's going to happen during that so that we can assuage the owner's concerns, say, yes, it may get a little worse to begin with, but here's what's going to happen. And eventually all the horses in the barn may get it, but we'll keep it isolated. We'll have certain protocols to identify it early so that if antibiotics or some sort of treatment is necessary, we can get at it earlier. That's the type of approach that a veterinarian brings to the table that I think is so important, not just in terms of the actual technical skills, but in the client-patient relationships. I mean, that's what it's all about, that they want to make sure their animal is going to be okay at the end of the day, or their family member, frankly, with COVID is going to be okay at the end of the day, or at least have a protocol to deal with things that inspires confidence. And I think that's the big deal here with what we do as veterinarians, and we saw during COVID, so important, as I alluded to, just to keep your sanity, make sure you felt good about what was going on, you could get through that day. These are all tough issues, not just for veterinarians, but for the public at large. Over these last 2 years, we're still seeing the fallout. When our schools, our kids are having trouble re-socializing again. Frankly, maybe some of us are too. And based on some of the phone calls my office gets, some of these people calling in need a lot of socialization so that they feel comfortable that we're all doing our best on their behalf, and to ratchet down the level of angst out there a little bit. And I think that's what the pet human animal bond is just so critical for at the end of the day, and makes us I think better people for it, and when it's all said and done.
Agreed. Yeah, and there's no doubt the health of animals and humans are in fact interconnected, and that veterinarians play a key role in protecting the health and well-being of both. So I'd like to pivot by asking about some of the top issues facing veterinarians from a Zoetis Habry International survey conducted earlier this year of 1,350 veterinarians across 9 countries and 4 continents. We know that veterinarians around the globe are facing significant mental health challenges, including burnout. I spent the entire summer traveling around the world, meeting with veterinarians, and can attest to the challenges maintaining mental health and well-being in our profession. And that's global. It's not just a Western phenomenon. The pandemic has certainly been a tough time for everyone, especially hard on veterinarians and their teams. So can you tell us about your work supporting the veterinary profession in Congress and your leadership of the Veterinary Congress?
Well, yeah, no, it has been very, very difficult times. Speaking generally, as we've talked about here, the toll that COVID has taken on the mental health of virtually every person around the world. Veterinarians, as we know, have issues already prior to COVID. It's a tough profession to be in, often isolating, high demands, a lot of stress. When I was doing emergency work after hours, you still had your hours to do during the day. You had a family at home. I mean, it is a tough job. And a lot of us, labor in smaller practices, some larger practices, maybe a little bit easier, but still some of those same stresses. And, the whole protocol for veterinarians during COVID, it was very difficult. You couldn't have your clients in the office with you if you're a small practitioner. You had to, have your pets brought in. You lost a little of that understanding. I always felt it was wonderful sitting across an exam table, talking to the clients about what, Fido or Fifi needed at the end of the day, and convince them why it was important to do these things. A little tougher to do. I've got great staff, and certainly I think our technicians deserve a ton of credit, also facing a lot of stress and mental health issues, because they're now having to do the bulk of that with the clients and assuring them that things are going to be okay. When in Congress, as some of you probably already know, there's a veterinary caucus that myself and Dusty Johnson, a good friend of mine, Republican from South Dakota, are in charge of. He covers particularly the livestock side. I'm probably more the companion animal side. And together, I think we do a pretty good job of keeping folks in Congress, again, the staff as well as members, up to speed on what legislation's coming down the pipe. What are some of the new zoonotic diseases, the avian flu, for instance, that we're seeing, all these things that are going on right now. We can keep people up to speed. And again, knowledge is power. I have found in my tenure on this planet that Oregonians, and I think all Americans, can accept a lot of hardship as long as they know what the score is, what's going on, and how to approach it. And that there's others that are in positions of power that have their best interests at heart. And I think that's part of why this veterinary caucus is so important. Making sure that folks understand some of these problems, whether or not they're zoonotic, to humans, all that sort of, because with COVID, everyone's a little touchy right now. The monkeypox is a big issue, obviously, for a lot of folks, and we have to keep that in perspective. It's no COVID, but let's just be smart about it and use lessons we've learned. We can do that in our veterinary caucus and spread the word, nice bipartisan, even, thoughtful manner that inspires, again, hopefully confidence and compliance with protocols and get out of the political sphere altogether.
Yeah. Well, we really appreciate your time, Congressman, and very happy to have you for Pet Week one last time. And before we wrap up, I'd love to ask you what your hopes and your priorities are for animal health issues in Congress as we look ahead to the future. And I also want to give you the floor to share any additional words of wisdom you have for those watching today.
Well, I think the name of the game is keep our eye on the ball. The One Health program, I think, is probably one of the more important pieces of legislation that will be incorporated, maybe not in a bill just by itself, but in a variety of different legislative vehicles to make sure that as we get into this interconnected 21st century, we see that we're so dependent on others around the world, whether it's chips or pharmaceutical ingredients, rare earth minerals, you name it. We cannot go back to a America only thing. We can near shore, friendly shore, some of our resources. I think that makes good sense, but we're still going to have to be aware of things around the world. So One Health and having this understanding of how we interact positively with our partners around the world is just, I think, so important. So hopefully that will continue to grow and expand as we go forward. I think that's probably the biggest deal. Then push some of these others across the line. I guess my Zoetis has been a huge partner. I really appreciate all their work and hanging in there with us, along with the other animal industry health partners, because it takes a while to get some of these issues resolved and across the finish line. So I'd urge everyone not get discouraged that the PAST Act hasn't passed yet. We're so close, and it takes time to socialize these issues with folks in a variety of different areas and disciplines that don't have the same view maybe the veterinarians do or some pet owners. So let's work through some of these issues and I would say in parting that the Congress is not as partisan as it's made out to be on TV. Certainly the far left get lots of the far right get lots of the media attention, but there are the show horses and there's work horses, and yours truly is a workhorse. Like most veterinarians, our job is to get something done. We cannot just talk about things. We actually should accomplish things, make that animal better, get resolution. And so that's what I've been proud to do over my tenure in the United States Congress. And I think most members, believe it or not, are like me. And we've had some huge wins on huge issues. The infrastructure, bipartisan infrastructure bill, totally bipartisan. The Competes bill, trying to make sure we nearshore some of the chip manufacturing so we can actually get a new car if we want one, and things like a lot of the other issues that plague our society. We do find ways to get together. It's not the perfect solution by some person's standard, but it's probably good because it strikes that balance where both sides feel, okay, at least I've been heard. And Congress does a pretty good job, believe it or not, in that arena. We're going to have an opportunity. We're going to be celebrating, of course, the passage of the Inflation Reduction Act, so get our budget under control, and at the same time, do a wonderful job on prescription drugs, making sure seniors can negotiate drug prices just like the rest of us do in our daily life, and car loans and everything else, limit out-of-pocket costs for folks and rein in some of the excessive costs. But we're working closely with our partners in the pharmaceutical industry, frankly, as well as our partners across the aisle. Aren't really excited about all the aspects, but it's a pretty good piece of legislation. I think overall it does a great job. So we're working hard. Congress has your back, believe it or not, at the end of the day. So continue to have a little faith and elect good, thoughtful people to public service.
That's great, Congressman Schrader. I think those watching have a lot to think about, and we certainly still have plenty of work to do. So thank you very much for your time today. It's been a pleasure talking with you again during Pet Week and learning more about your many, many accomplishments. On behalf of Zoetis and Habry and the entire pet care community, thank you for your leadership and your incredible work in supporting the human-animal bond.
Thanks so much, Mike. Great to be with you all again.
You as well.
That was an amazing, illuminating conversation. Thank you so much, Representative Schrader. Thank you so much, Dr. McFarland, for sharing your words of wisdom with us. I know I learned a lot. And thank you so much to Zoetis for sponsoring this session, for making this possible. And thank you to all of our Pet Week sponsors for a great week of programming about pets and all things related to the human-animal bond. I hope you'll come back to petnight.com for future sessions and also to watch the sessions that have already aired on demand. And please feel free to share those with others so that they can benefit from this information and programming. Thank you again for joining us, and I hope we'll see you soon.